NLN NEX quiz. Question 1. Which increase is shown from Monday 14 to Wednesday 19 in a simple practice chart in the sample size item? Option A, 5. Option B, 3. Option C, 33. Option D, 19. The correct answer is option. The increase is the final value minus the starting value, 1914 equals 5. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 2. During a quick NEX review of an enzyme activity item, which word is closest in meaning to rapid in a science paragraph? Option A, fragile. Option B, dull. Option C, slow. Option D, fast. The correct answer is option. Rapid means fast, so that choice matches the meaning in context. Fragile means easily broken, not fast. Dull means not sharp or interesting, not fast, and slow means not fast. Question 3. After checking the choices in a pH scale item, which answer identifies the process moves water across a semi-permeable membrane? Option A, mitosis. Option B, transcription. Option C, exocytosis. Option D, osmosis. The correct answer is option. Osmosis is the diffusion of water through a selectively permeable membrane. Mitosis is cell division, transcription copies DNA information into RNA, and exocytosis moves materials out of a cell. Question 4. If a solution chemistry stem gives one clear clue, which choice most accurately summarizes the passage? A patient education sheet used short sentences, headings, and pictures. Option A, headings reduce the value of information. Option B, clear formatting helps readers understand health information. Option C, long paragraphs are best for patient teaching. Option D, pictures make written instructions unnecessary. The correct answer is option. The sheet is designed to improve readability and comprehension. Headings reduce the value of information, is not supported by the passage. Long paragraphs are best for patient teaching, is not supported by the passage, and pictures make written instructions unnecessary, is not supported by the passage. Question 5. When time is limited on a genetics clue question, which increase is shown from Monday 18 to Wednesday 26 in a simple practice chart? Option A, 5. Option B, 44. Option C, 8. Option D, 26. The correct answer is option. The increase is the final value minus the starting value, 2618 equals 8. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 6. Given the information in a cell division item, which second quantity matches a 2:6 ratio when the first quantity is 6? Option A, 18. Option B, 24. Option C, 6. Option D, 21. The correct answer is option. The first part grew from 2 to 6, so the scale factor is 3. Multiplying the second part, 6 times 3, gives 18. The other values use the total, the first quantity, or an extra scale step instead. Question 7. Suppose a similar bone support item appears on test day. Which word is closest in meaning to retain in a science paragraph? Option A, discard. Option B, expand. Option C, guess. Option D, keep. The correct answer is option. Retain means keep, so that choice matches the meaning in context. Discard means throw away, not keep. Expand means increase, not keep. And guess means estimate, not keep. Question 8. While working through a timed muscle movement set, which answer identifies the tiny air sacs exchange oxygen and carbon dioxide? Option A, nephrons. Option B, alveoli. Option C, bronchi. Option D, villi. The correct answer is option. Alveoli provide thin, moist surfaces where gases diffuse between air and blood. Nephrons filter blood in kidneys, bronchi carry air toward the lungs, and villi absorb nutrients in the intestine. Question 9. Before choosing an answer in a nerve signal item, Which choice most accurately summarizes the passage? A volunteer program grew after former patients shared personal stories at orientation. Option A. Former patients stopped the program. Option B. Personal stories can motivate people to participate. Option C. Orientation should never include stories. Option D. Volunteer programs grow without communication. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Former patients stopped the program, is not supported by the passage. Orientation should never include stories, is not supported by the passage. And volunteer programs grow without communication, is not supported by the passage. Question 10. A student sees this endocrine message idea on a NEX review. Which answer identifies the group that does not receive the experimental treatment? Option A. Control group. Option B. Experimental group. Option C. Sample. Option D. Conclusion. The correct answer is option. A control group provides a comparison for the treatment group. Experimental group receives the treatment, sample is the participants or items studied, and conclusion is the final interpretation. Question 11. 1 Glucose regulation practice problem tests this skill. Which weight in pounds is closest to 70 kilograms using 1 kilogram equals 2.2 pounds? Option A. 1,540 pounds. Option B. 72.2 pounds. Option C. 154 pounds. Option D. 31.82 pounds. The correct answer is option. Multiply kilograms by 2.2. So 70 times 2.2 equals 154 pounds. The other choices divide instead of multiply, add the conversion factor, or move the decimal one place too far. Question 12. Several choices look tempting in a chart reading item. Which word is closest in meaning to temporary in a science paragraph? Option A. Permanent. Option B. Brief. Option C. Careful. Option D. Heavy. The correct answer is option. Temporary means brief, so that choice matches the meaning in context. Permanent means lasting, not brief. Careful means cautious, not brief. And heavy means weighty, not brief. Question 13. For this ratio setup nursing entrance question, which answer identifies the chemical messenger released by endocrine glands? Option A. Antibody. Option B. Platelet. Option C. A hormone. Option D. Enzyme. The correct answer is option. Hormones travel through the bloodstream and affect target tissues. Antibody targets antigens, platelet helps clotting, and enzyme speeds chemical reactions. Question 14. In a short unit conversion practice STEM, which choice most accurately summarizes the passage? A school added quiet study rooms, and students reported fewer distractions. Option A. Distractions are always helpful. Option B. Quiet rooms increase noise. Option C. Reducing distractions can improve study conditions. Option D. Students no longer needed to study. The correct answer is option. The result directly connects quiet rooms to fewer distractions. Distractions are always helpful, is not supported by the passage. Quiet rooms increase noise, is not supported by the passage. And students no longer needed to study, is not supported by the passage. Question 15. Among the choices in a percentage item, which critical thinking response best fits this situation? A conclusion says a new study method caused higher scores, but the groups were not randomly assigned. Option A. Random assignment is never useful. Option B. Higher scores prove every student studied more. Option C. The conclusion should ignore group differences. Option D. The conclusion may be too strong because another factor could explain the scores. The correct answer is option. Without random assignment, group differences may affect the result. Random assignment is never useful, does not follow from the situation. Higher scores prove every student studied more, does not follow from the situation. And the conclusion should ignore group differences, does not follow from the situation. Question 16. Using the facts in a fraction item question, which number is 12% of 60? Option A. 7.2. Option B. 20. Option C. 72. Option D of 48. The correct answer is option 12% means 12/100, so 60 times 12/100 equals 7.2. The other choices come from adding or subtracting the percent, moving the decimal incorrectly, or dividing in the wrong direction. Question 17. Based on the clue in a mean score item, which word is closest in meaning to adapt in a study guide note? Option A, ignore. Option B, expand. Option C, adjust. Option D, predict. The correct answer is option. Adapt means adjust, so that choice matches the meaning in context. Ignore means not notice, not adjust. Expand means make larger, not adjust. And predict means forecast, not adjust. Question 18. Consider this high-yield probability set concept. Which answer identifies the cell division that produces gametes? Option A, diffusion. Option B, mitosis. Option C, meiosis. Option D, translation. The correct answer is option. Meiosis reduces chromosome number and produces sperm or egg cells. Diffusion moves particles down a gradient, mitosis produces identical body cells, and translation builds proteins. Question 19. Near the end of a test strategy review session, which choice most accurately summarizes the passage? A report says infection rates fell after staff completed a hand hygiene refresher. Option A. The refresher removed all risk permanently. Option B. Training may have improved compliance with hygiene practices. Option C. Hand hygiene cannot affect infection. Option D. Training increased infection rates. The correct answer is option. The sequence suggests training supported better hygiene behavior. The refresher removed all risk permanently, is not supported by the passage. Hand hygiene cannot affect infection, is not supported by the passage, and training increased infection rates, is not supported by the passage. Question 20. Across similar main idea nursing entrance questions, which increase is shown from Monday 17 to Wednesday 27 in a simple practice chart? Option A, 27. Option B, 7. Option C, 44. Option D, 10. The correct answer is option. The increase is the final value minus the starting value, 27/17 equals 10. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 21. Since only one choice fits the inference clue, which probability describes drawing a red card from a set with 4 red and 7 blue cards? Option A, 11/4. Option B, 4/11. Option C, 7/11. Option D, 4/7. The correct answer is option. Probability is favorable outcomes divided by total outcomes, so the result is 4/11, simplified to 4/11. The other choices use blue cards, compare red to blue only, or invert the fraction. Question 22. From the information in an author purpose item, which word is closest in meaning to approximate in a study guide note? Option A, vanish. Option B, deny. Option C, estimate. Option D, polish. The correct answer is option. Approximate means estimate, so that choice matches the meaning in context. Vanish means disappear, not estimate. Deny means refuse, not estimate. And polish means smooth, not estimate. Question 23. At a testing desk during a summary task review, which answer identifies the solution with pH above 7? Option A, hypotonic. Option B, basic. Option C, neutral. Option D, acidic. The correct answer is option. A pH above 7 indicates a basic or alkaline solution. Hypotonic describes lower solute concentration, neutral describes pH 7, and acidic describes pH below 7. Question 24. Inside a sentence correction science or skills item, which choice most accurately summarizes the passage? A clinic sends appointment reminders, and missed visits decline. Option A, reminders can help patients remember appointments. Option B, patients cannot benefit from reminders. Option C, reminders caused more missed visits. Option D, appointments no longer need scheduling. The correct answer is option. The decline in missed visits supports the role of reminders. Patients cannot benefit from reminders, is not supported by the passage, reminders caused more missed visits, is not supported by the passage, and appointments no longer need scheduling, is not supported by the passage. Question 25. Through careful reading of a punctuation review stem, which answer identifies the transfer of heat through direct contact? Option A, conduction. Option B, radiation. Option C, convection. Option D, evaporation. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Radiation transfers energy by waves, convection moves heat through fluid circulation, and evaporation is liquid changing to gas.